this in like 5 minutes, maybe like 10. But I did say that there will be a possible, well, really an opportunity to get some extra credit. And normally I don't do that. I'm a kind of professor where you got to earn your grade, seriously. But here's the deal. So at this point, you all have taken 15 quizzes. At least 15, right? Some of you may have forgotten, but you have taken at least 15 quizzes, which means I dropped the lowest 5 because I only record 10 quiz grades. Okay, that's hopefully 100 points for you. Okay, great. Well, I said in your syllabus, there is no quiz for chapter 24. In your syllabus, it said no quiz for chapter 24. But if you want to take the quiz chapter 24, that's fine, which means it's extra, right? Yeah. It's extra. So if you want, who keeps that back door open? You got a key? So if you want to take this chapter quiz when we're finished, you can do that. Well, here's the deal, okay? If you have taken at least 10 quizzes, right, for your minimum, right, you need at least 10 quizzes for your grade, okay? Well, this quiz will be extra, which means if you get, let's say, 90 to 100, I'll give you an extra 5 points. And it may help you. It may help you. I mean, who don't want 5 points, right? Free 5 points. So if you get a 90 and up, I'll give you 5 points. Okay, some of you got an 88, for example, right? I can get you to your A. All right, great. Now, if you get, let's say, an 80 to an 89, I'll give you 3 points. That's it. So you got to make at least 80 to get some points. So 80 to an 89. Yes, Judge, this is true. 80 to 89, I'll give you 3 points on this quiz only. Okay, 90 to 100, give you 5. Yes, Brooke. Is that your hand?
Yeah, what are you adding the 5 points to? Our overall mark?
According to your syllabus, I don't do averages. In other words, it's a point system. It's a point system. Go to your syllabus, all right? Basically, if you add up all your points, it's a total of 600 points that you get in this class. Yeah. 540 to 600 is an A. So in other words, you just add 5 points to whatever, however many points you got. Make sense? It may get you to your 540, which means you got an A. Make sense? Good. Right? So that's my gift to you. Fair enough. All right, let's go. Now, this chapter, I told you to bring your condoms. This chapter is all about what? So basically, urinary tract disease and also disease of the reproductive system. Okay, it's not that long, it's not even that difficult. Okay, real quick. Now, in terms of the urinary system and the reproductive system, in females, there are 2 distinct systems, which means the organs are separate from each other. They are not shared, okay? Now, in males, for example, in males, the urinary system as well as the reproductive system, they share some parts. For example, in males, the urethra will be used for the urinary as well as reproductive. In females, everything's all separate, so you already know that. I'm not going to spend too much time on anatomy. This is not A&P 1 or 2, okay? Real quick, basically, the urinary system is in charge of what? Basically, filtering out waste from the blood, right? You excrete it out as urine. You already know that. Here's what you know. Now, in terms of the female reproductive tract, okay, you know you got your ovaries where the eggs are made, you got your uterine tubes that lead the egg down to the uterus, and it's fertilized, great. The vagina is basically the opening from the outside world to the uterus, great. And also external genitalia like the labia, okay. Now, in terms of how do microorganisms get into the reproductive tract in females, it's through the vagina, okay. All right, real quick. In males, okay, males have the testes where the sperm are made. Testes are inside the scrotum, right? Now, in terms of how to get the sperm out, well, a series of ducts will carry the sperm from the testes through accessory glands like the prostate gland. Prostate gland creates fluid, adds it to the sperm to make semen, right? Right? And then the semen comes out through the penis. Great. All right? Now, in terms of men, microorganisms can get in through the urethra or through the skin of the penis. Now, here's the deal. Now, in terms of being circumcised versus uncircumcised, okay, uncircumcised males have a higher risk of getting STDs, for example. And you're like, that doesn't make sense. Well, it actually does. For example, if you cut off the foreskin, okay, the skin on the tip of the penis gets harder, gets tougher, which means it's less likely to develop small tears during sex. In other words, if a guy's going to get an STD, okay, and if that bacterium is not going to go into the urethra, they can get in through cuts through the skin, right? You got to get through the skin. Well, during sex, you can get tears, micro tears you can't even see. Now, if the male is circumcised, for example, the tip of the penis is actually harder, which means it's less likely to tear during sex. But in uncircumcised males, they've got the foreskin, and that foreskin keeps the skin underneath kind of soft, which means bacteria can get into that area. Likewise, the foreskin keeps bacteria trapped in that area, which means, this making sense, right? Which means the germs are going to be stuck there for a longer time, which means it gives them a more opportunity to infect you, makes sense? So it's better, in that case, it's better to be circumcised versus uncircumcised. And also, it helps the female partner too, because the females, for example, if the male is uncircumcised, he's going to have more bacteria in that area, which means she's more likely to get some infections too. So that it works out for everybody in that relationship, okay? Okay. All right. Blah, blah, blah. Okay, normal flora in the urinary system. So basically, the only place that bacteria are normally found, okay, you can find them in the urethra. They can be found in the urethra, but that's basically it. Now, within the urethra, you can find lactobacillus and also staphylococcus. Now, these species of staphylococcus are going to be the non-pathogenic kind. So don't think they're all staph aureus, right? So staphylococcus would be Staphylococcus epidermidis, for example. So they're all not bad, all right? So the ones that are in the urethra, they're going to be non-pathogenic. Now, the remainder of urinary organs are going to be sterile, which means if you get bacteria in the bladder or into the kidneys, you've got an infection which can lead to disease. Makes sense? So you don't want that. All right. In terms of the male reproductive tract, the regions above the prostrate gland are going to be sterile, so you don't want any bacteria into there, because if you get bacteria into the prostrate, you're going to feel it. It's going to cause inflammation. It's going to be very, very painful. Okay? Very painful. In terms of the female reproductive tract, okay, you already know the vagina has lots of microorganisms there, and they depend on hormone levels. So the hormone levels fluctuate throughout the menstrual cycle, and particularly got lots of lactobacilli in the vagina. They help to keep the pH low. So basically, this is very important. The lactobacilli in the vagina keep the pH between 4.0 and 4.5. That's pretty acidic, right? Which means many other bacteria don't like that. So lactobacilli in the vagina help to keep other bacteria and also yeast in check. Which means if you mess up the normal flora in terms of the lactobacilli, if you mess them up and they're gone, that means the pH is going to go up, right? It's going to rise, which means other bacteria and yeast can overgrow, and that can cause infections, which leads to disease. Make sense? Good. Okay, blah, blah, blah. Now, in terms of how do you get infections in the urinary system, well, basically bacteria literally climb their way up the urethra. They get into the bladder. From there, they go up the ureters and end up to your kidneys, right? That's not good. In terms of STDs or venereal diseases, so back in the day, right? STDs were venereal disease, or VD for short, okay? In terms of VD or STDs, well, they can basically get in through, if it's guys, through their urethra, if it's women, through their vagina. All right. Real quick. Now, the first couple of diseases is going to be non-venereal, which means they're not STDs. What does that mean? They're not spread via sex. Make sense? These are non-venereal diseases. Real quick, first up, UTIs. Talked about it in lab recently. Signs and symptoms, okay? Well, sometimes you can have frequent urge to go to the bathroom, but then you go and no urine passes out. So in other words, you have a frequent urge to go, but you get there, no urine comes out, okay? Also, if you do pass urine, it may be painful, so you may have painful urination. If the bacteria are in the bladder, you will have bladder pain. So you have pain right in here, around your bladder. It will be pain, it will hurt, okay? You'll feel that. Now, if the bacteria make their way up the ureters and into your kidneys, you'll feel that too. You will feel that. You get flank pain, basically along the sides here. If they hurt, and you're vomiting, you got fever, basically you got a UTI that made its way up into your kidney. And you got to get that treated, because that can lead to death, all right? In other words, don't let a UTI go untreated, because they don't go away by themselves. They basically keep on going up until they get to your kidneys. At that point, they'll take you out if you don't get on antibiotics. Okey-doke. Now, in terms of who are the major players, usually it's enteric, meaning in the gut bacteria, right? Because they're in the gut, which means they come out in the anus. And if you're not careful about how you wipe yourself, you can introduce them into the urethra, right? And then they literally make their way up the urethra into the bladder and so on and so forth. All right. Now, E. coli causes most cases, because why is it an enteric bacteria? But there are some other non-enteric bacteria that can also cause UTIs. For example, Staph aureus and also Pseudomonas, okay? They can also cause UTIs. Now, the important virulence factors, okay, first of all, I said what? They have to be able to do what? Climb up the urethra, right? They have to. So in other words, they either need flagella, right, or fibrillate to get up the urethra. Makes sense? They're climbing up there, literally. That's what they're doing. What we doing? I talked about how you get it, right? You basically self-inoculate yourself, right, from feces. You wipe the wrong way, right? Okay, you introduce them into the urethra. Now, UTIs are more common in females because the urethra is basically shorter. It's basically 4 centimeters in women versus 20 centimeters in men. So literally, the bacteria have a shorter distance to climb in women, right, versus in guys. Also, in women, it's the proximity, right, of the anus to the urethra. It's very close together versus in men, not so much. Makes sense? So UTI is common in women, not so in guys, but they can get it. Now, how do you diagnose it? Basically, you pee in a cup. And from that point, someone looks at your pee and they look for lots of white blood cells in your pee. It's a visual diagnosis, visual. Look for lots of white blood cells in your pee, which means what? You got an infection, right? Exactly. So that's exactly what they do, right? Right in the doctor's office and they put you on something real quick, all right? Now, I wouldn't say some, all of them require treatment with some kind of antimicrobial drug. As I said, but if you don't treat it early, those bacteria will keep on climbing, makes sense? You don't want them to get to your kidney because that will really make you sick. It will make you sick. Okay. Now, basically, how do you prevent it? Lots of ways. For example, if you are having sex with females, use the bathroom before, use the bathroom after, literally. Because I said what? Guys have bacteria on their penis? Sure they do. It's basically skin. Okay. So what you should do is use the bathroom before, flush out bacteria, right? Flush them out. Use the bathroom after. Simple. You cut out most UTIs just by doing that, okay? And also wipe front to back, correct? All right. Next up is basically toxic shock syndrome. The most guys have heard of it, but many females have, correct? Y'all shy today. Okay. Okay, you've heard of it. Okay, so signs and symptoms. Exactly. So toxic shock syndrome, okay? Basically a sudden onset of fever. You basically have a severe red rash. Okay, low blood pressure. Low blood pressure leads to shock, which means if you get to that point, you are dead, okay? You died from that. Now, causal agent, Staphylococcus aureus is your favorite opportunistic pathogen, okay? Now, certain strains of Staph aureus, okay, they produce this toxin, and that toxin is basically the cause of toxic shock syndrome. That toxin is an exotoxin, which means if you have this Staph aureus in the vagina, or it gets into in a wound, for example, it releases this exotoxin. That exotoxin gets into your bloodstream, and it causes toxic shock syndrome. Now, what's going on? So I just explained that part. The toxin gets into your bloodstream, and it triggers your immune system. So basically what is happening, this toxin activates your T cells, overly so. Now, all these activated T cells, they release all these cytokines, and we talked about that in chapter 16, so it should not be foreign now. So all these activated T cells, they activate all these cytokines, and basically all these cytokines in your blood system give you the syndrome of toxic shock syndrome. So all those symptoms I gave you, it's basically the result of your immune system. So far, so good? Y'all got to test on all this on Tuesday. All right. Now, basically, diagnosis on signs and symptoms, because literally, there's no picture of it, but you literally have a red rash, a horrible rash on your body, and it's sudden onset of it, too. So you know you got that, something's not right, okay? Go to the hospital. It is considered a medical emergency, right? Because it leads to shock. That's why it's called toxic shock syndrome. Shock kills you, right? Now, basically, it's attributed to basically tampon use. So simply put, back in the days, people used to use super absorbent tampons. No good reason. Now, these super absorbent tampons are good breeding grounds for Staph aureus, especially when there's blood on it, and especially when the tampons are left in for too long of a time. So now you got Staph aureus is having a ball in there. Okay? Which means that they're having a ball, they're growing and making all these toxins, which gets into the woman's bloodstream, and it kills them. Alright? So basically, to avoid it, okay, use tampons, ladies, that are less absorbent, okay, and take them out frequently. Don't leave them in too long, take them out frequently, alright? Simply put. Now look at this map. Now Milton was saying he remembered that when he was younger, right? So look at this map, okay? So back in the 80s, 1980, you had 1,200, this is an epidemic, right? Right, is that an epidemic?
Yeah.
Okay, so 1980, you got 1,200 women dying from toxic shock syndrome.
It's on the news every week.
Yeah, from toxic shock syndrome, basically from tampon use. Now, we get rid of these super absorbent tampons, and then in 82, now from this point on, the FDA says in every freaking tampon box, you gotta put a leaflet in there about what? Toxic shock syndrome. That's why I said ladies know all about this. Every tampon box you got has a little leaflet about TSS, right? Tells you all about it. Now from that point on, right? Now it's about 78 cases in the whole U.S. In the whole country, 78 cases of TSS, right? Not bad, right? Just by education. Just educate females, takes care of the whole problem. Got it? Okie dokie. All right. Next one again, these are non-VD, right? Okay, so they're not STDs. Bacterial vaginosis, okay? How do you figure out you got it? Well, you have a white discharge, but it's going to have a fishy odor. So basically, a discharge in females is not indicative of an infection, because you can have discharge increasing based on ovulation. But if you got a discharge that's not smelling good, something's not right, okay? So it's going to be fishy and it's odor, all right? In terms of the bad guys, various anaerobic bacteria, but here's the one you got to know, Gardnerella vaginalis, one agent that causes vaginal vaginosis, or bacterial vaginosis, excuse me. Now, in terms of the pathogenesis, basically it's not an STD. What happens is the normal flora and the vagina are screwed up. So you want lots of lactobacilli. Why? Because they keep the pH low. But for example, if you end up douching down there, which you don't have to do in the first place, because the vagina takes care of itself in terms of cleansing. Okay? If you use a douche, for example, you wash out the lactobacilli, which means you wash out all the good guys who keep the pH low. These guys, they like a higher pH, makes sense? So if the pH is higher due to a lack of who? Lactobacilli, you get other bacteria growing in that area like this guy and causes that fishy odor. Now, it says associated with multiple sex partners, but again, like I said, there are bacteria on a penis, so if you got penis in there, they're going to introduce bacteria in that area, and if there's no lactobacilli there, right, they're going to have a ball, make sense? Okay. All right. Now, in terms of diagnosis, basically based on signs and symptoms, but basically just use some medicine, take care of it, you're all set, got it? Okay. Now, one way to diagnose vaginosis are basically looking at clue cells. So clue cells are basically vaginal epithelial cells covered with anaerobic bacteria. So all these little blue dots here, all those blue dots are bacteria. These are the bad guys. So you look for clue cells to diagnose bacterial vaginosis, okay? Y'all having fun so far? Y'all looking bored out there? I'm going to stop and go home. Vaginal, now here's the deal, I had to put this in red because in your notes that title was wrong. I think the title was the old guy, that title was bacterial vaginosis. Okay, so at this point, if you're talking about severe itching and burning, that's a yeast infection, okay? So this is vaginal candidoniasis, okay? So basically a yeast infection, not a bacterial infection. Please change it in your notes, thank you very much. Now, ladies know about this, they don't want to tell you guys, they know. So, if you got a yeast infection, it's severe vaginal itching and burning. They, being the females, they may or may not have a discharge, but if they have a discharge, it's going to be cottage cheese-like, so very thick, it's looking like cottage cheese if they have discharge. But that may not be there, but you will have severe itching and burning in the skin, and the labia region will be very red, okay, apple red in color. Okay. The causative agent is Candida albicans. It's basically a yeast. Now, Candida albicans is a part of your normal flora. Okay? It's a part of the normal flora in the vagina. But remember, I keep trying to get this point home, right? Lactobacilli keeps everybody else in check. Makes sense? Everybody else is kept in check by lactobacilli, which means if they are screwed up in some way, for example, if women are on antibiotics, kills lactobacilli too. That means there's no one in the vagina keeping the pH low, makes sense? And allows sometimes the yeast to overgrow. So basically, a yeast infection is what an overgrowth of the yeast that are already in the area in the first place, right? Okay, just talking about that. Now, in AIDS patients, right, These yeast infections can be systemic. They can have it all the time. And they can also be in their mouth. So basically, a yeast infection in your mouth is called thrush. Okay? It's the same Candida albicans, but it's in the mouth, okay? So AIDS patients definitely have thrush because their immune system is compromised. All right, let's talk about that, okay? You basically identify Candida, but all you gotta do, the physician just looks at the area, and if it's bright red, they already know it's a yeast infection. And many women basically self-diagnose themselves. If you had one, you know what it feels like, so you know what to do. You basically go to Walgreens and buy some Monistat and you keep it moving. Just being frank, right? Women know what it feels like. The first time, if you never had one, okay, the first time you do go to the doctor and they'll tell you it's a yeast infection. But after that, you already know the deal. And you just go get some Monistat and you're done, okay? Now, blah, blah, blah. How do you avoid yeast infections? Well, one thing is, you can't really avoid, you can't avoid using antibiotics, but avoid excessive use of them, okay? Because why? Excessive use takes away the lactobacilli that keep everybody else in check. Also, for example, sometimes you really cannot prevent a yeast infection. Because I told you earlier that the pH of the vagina can change with the menstrual cycle. It can change when a woman is pregnant. So sometimes pregnancy, you get a yeast infection. Or at the end of your menstrual cycle, you can get a yeast infection. So that you can't really help. But also, don't wait around in a wet bathing suit. Don't do that either. You hang around in a wet bathing suit, you create an environment that's good for yeast, and they will grow very well. Makes sense? So out the pool, get out of that bathing suit. Don't hang around in that.
So when you're picking up your antibiotics at Walgreens, just go and grab some.
Yeah, go get some Monistat. So you go to Walgreens to get your penicillin, go ahead and get a box of Monistat as well, just in case, just in case. Save your trip. Now at this point, we're talking about venereal or BD diseases or new school STDs, all right? Now they are common worldwide. In some places, they could be endemic, all right? Now, of course, young people are at risk because they like to experiment and they don't know what they're doing, okay? They're at risk, and they take risks. Why? Because their frontal lobe has not done maturing, so they make poor decisions, literally. So they are the ones that, I'm telling you the truth, there may be some young people here today, I'm telling you, if you're young, you make bad decisions because literally that frontal lobe is not mature, and they do stupid stuff sometimes, all right? Okay, now here's the deal. Lots of STDs, if they produce a lesion, that makes you at a higher risk for developing HIV. Because if you have a lesion from another kind of STD, that lesion allows HIV and easy access into your blood system. Right? So that's not good. Right? Now, young females are at a higher risk because their cervical lining is basically immature. So their cervical lining is immature, which makes it more prone to infections versus a mature woman's cervical lining. So these young females are out there having sex. They are at higher risk because their cervix is just not all that mature in terms of the actual cell, which makes them easier to pick up diseases. So they are at higher risk, all right? How do you prevent it? So basically put abstinence. If that's not going to work for you, okay, mutual monogamy. That's the best thing to do, right? The best thing is mutual monogamy if you can't abstain from it. All right? Condoms got to be used properly and every single time, right? Every single time, because if you get one, then you're screwed. Because some of these STDs, your partner may not even know they have it, right? So we'll get into that. First up is gonorrhea, all right? Now, gonorrhea basically means flow of seed in Greek. Because people thought long time ago, back in the 2nd century, people thought that the causative agent was excess semen. That's gonorrhea, okay? Now, in men, they know when they have it, okay? They got painful urination, like they're urinating fire, basically, and a pus discharge, lots of it. So they know they got it, they know, okay? Sometimes in women, it's asymptomatic, which means they may be infected with gonorrhea and they may not even know, which leads to complications later on. So that's not good. But if females have symptoms going to be same like the men, they're going to have painful urination, like peeing out fire, and they'll also have a pus discharge if they have symptoms, right? Because most women are asymptomatic, which means if they don't have symptoms, right, they will later on develop PID, which is basically what? Pelvic inflammatory disease. Now that is serious because it's basically inflammation of the uterus. Oh boy, that's not good. Also, the fallopian tubes, they get scarred. That's not good either, which means later on you try to have a child, you can't. Why? Yeah, you had PID, which makes you sterile, long term. So it's not good. It does make you sterile. Or leads to ectopic pregnancy. So basically, the fetus develops in the fallopian tube. The fetus dies, and if you don't take care of it, you die too. Simple as that. All right. Now, the cause of agent, Neisseria gonorrhoeae. That was easy to remember. Now, this is why he's bad. He has fimbriae and a capsule. Both of these guys allow him to stick to your epithelial cells. And literally, okay, how do they get in here? Because PID occurs in the uterus or even the fallopian tubes. Well, how does he get there? I mean, he can swim, but he can't swim that far, okay? How does he get there? Well, he uses his fimbriae to hitchhike, literally. So he gets into the cervix and he kind of stays there, the cervix. So in women, the infection takes place in the cervix. That's where he's hanging out. Well, sperm, if they're swimming past the cervix, they get on the sperm. And they go where the sperm goes, into the uterus, into the fallopian tube. And that's how women end up with PID. Makes sense? They got a ride from the sperm. Right? They get shot with something. Okay, so I talked about that, right? They literally attach themselves to the epithelial lining, but in women it's their cervix. That's where they're hanging out. All right? Now, gonorrhea only happens in people, and most of these STDs are like that. So most STDs occur in people only. So people are the natural host. And of course, you increase your frequency with many, many sexual encounters or different sexual partners. So again, that monogamy, do that. You can't abstain, have a monogamy or monogamous relationship. Now, in terms of how do you diagnose it, okay? Well, looking at the pus is just not enough, okay? Basically, you use DNA probes to actually determine this is indeed Neisseria gonorrhoeae. Of course, use antibiotics, and I'm not going to get into how you prevent it, right? You know what to do. Use condoms every freaking time, right? Abstain, or just have the same sexual partner. That's how you prevent all these guys. I'm not going to say it again. Okay. Okay, look at the incidence, okay? So, up to 1 million cases in the 80s. What was going on back then, Milton? What was going on in the 80s? Golly. But at least we got smart, okay?
It was
Got
half the
smart.
time.
Golly. Well, at least nowadays, we're down to almost 100,000 cases in the U.S.
That's when all the flower children were teenagers.
That's what happened.
Think about
A million
it.
cases.
Because that's the flower,
Yeah.
that's the wild '60s generation. That's their
Yeah.
teenagers, and what they get from mom and daddy.
I'm telling you.
I'm just saying, everything's okay. It's all okay.
It's all okay, not
But it wasn't. What?
That ain't no
We
okay.
found out about AIDS, toxic shock, gonorrhea. We got all that
All
stuff
that
about
in the 80s.
it. Y'all got to get back
I
to
was
each
a
other.
kid back then.
Well.
I was wild back then.
Well,
Boy, I didn't know any better back then. I was just in elementary school. Okay, look at this. Look at this. So in the southeast is where most of the cases are. In the southeast, all right? That's where most cases are, including Florida, right?
and I was down there in Mississippi. What?
Oh, my word. Goodness gracious, Milton. The whole state is red, and I'm not going either.
Look at Maine though. I don't know if just nobody
It's
lived
too
in
cold
Maine
in
at the
Maine.
time, or if nobody just
In Maine,
wanted to do anything.
It's too cold. It's too cold.
Too cold.
They don't have time.
Unless
Down
it's
in South
everything in the
Florida.
whole state.
It's hot
Down
going
south.
on in the south.
Y'all in Florida, I don't know. Isn't that Broward?
Tampa got it going on. Tampa.
Don't go over there and find nobody, okay? Find somebody in Port St. Lucie, safe. Safe. Goodness gracious, okey doke. Next one.